birth practices known to improve quality of care and reduce maternal and newborn harm. The design in checklist form draws lessons from other industries that have promoted safety, such as aviation. The WHO Safe Childbirth Checklist is designed around 4 pause points. These are critical moments of care during the delivery process when complications can be averted and appropriately treated, with items concerning both the mother and baby. The first pause point is on admission, the second is just prior to delivery, the third is within 1 hour of birth, and the fourth is just before discharge. The checklist, of course, should and can be modified to fit local context and guidelines. In our second webinar, we discussed the first step of the implementation pathway, engage. We learned how to ensure buy-in and identify relevant stakeholders for implementation. We discussed how to establish an implementation team to take ownership of the WHO Safe Childbirth Checklist implementation process. We reviewed the purpose of conducting a needs assessment, which can serve as a baseline for implementation efforts and tracking progress. We also shared best practices and checklist adaptation to fit local context and needs. And we also heard from Dr. Rosemary Ogu about how she engaged her facility and implemented the WHO Safe Childbirth Checklist in Nigeria. Before we get started, we'd like to take a moment to ask our audience in our webinar series so far, which topics would you like more information on? Please take a moment to respond to this poll on your screen.
Biha, we're just waiting for a few people to finish up that poll. You should be able to see the results now.
Wonderful. Thank you all for responding to the poll. So it seems that some topics of interest include conducting a needs assessment, adapting the WHO Safe Childbirth Checklist, and determining program goals and gaining buy-in is also an interesting topic that we can certainly address in our question and answer period at the end of our webinar. Now, I will pass it on to my colleague, Emily George, who will orient us to the objectives for today's webinar on the next step of the implementation pathway, which is launch.
Wonderful. Thank you, Nabiha. So today, we're going to spend a little bit of time learning how to formally introduce the WHO Safe Childbirth Checklist in a participatory launch event. And we'll also talk through some practical tips for how to prepare for one and how to host a successful launch event. And then we're really excited to have some of our partners here from Mexico and Indonesia who are going to also share about their experiences. So the purpose of the launch event is actually just a time to formally introduce the WHO Safe Childbirth Checklist through an official event. And this is a time to share the vision for quality improvement and enhancing the maternal care that you're already providing in your facilities. And the idea is to really build an inspiring atmosphere, which is engaging for everyone that's going to be helping implement the checklist, as well as the other clinicians who are touching the patients every day and working in the facility. And this is also a time to set the stage for how the checklist will be implemented. So a couple practical considerations prior to the launch event. It's very important to determine the best time and place to hold your launch event. to find a time where most, if not everyone, can be there. And you want to make sure, especially, that your key leadership and your team members are available there to just garner support and show their buy-in for the implementation process. And we always encourage people to provide food, as we know that that's always a great way to win over people's hearts and get them to come to an event. And at the launch event, it's actually great to start with an inspiring story or a video. This can be something that you and your team discuss and figure out what would be the best thing to motivate people. And then the idea is to ask the audience to share their experiences and how maybe things could have been helped by using the checklist in the past, or how they see it being helpful in the future. And then it can also be a time for people to share testimonies of how the checklist has helped improve care in other places. And you're going to get to hear from some of those places today, and they would be willing, for you to tell their stories as well. And this is also a time to really address concerns that people may have with using the checklist. So in our implementation guide, which you can download from our website, we actually provide an outline that we have seen provide the most success for introducing this at a launch event. And we start with just introducing the implementation team, introducing the benefits of using the checklist, and then we really take some time to explain the 4 pause points and what the activities are for each one of those, and then demonstrate and explain proper use of the checklist. And then we think it's important for you to explain to everyone how implementation will be supported. So starting with introducing the implementation team, this is a time to just really encourage an open and welcoming environment. It's a time to introduce your team, and this is just taking into consideration that hopefully during the engage process and as you were preparing for the launch event, you have actually gathered a team together, and this can be 2 to 3 people or even more, and it's a time for you to explain their roles and how they're going to be supporting the implementation. Next, we want to talk about the benefits of using a checklist, and we talk about this a lot here at Ariadne. Why use a checklist? And we think about this even many times in our everyday life, that a checklist actually helps us remember to do the things that we need to do when we have other things on our mind or on our plate, or if there are things that are distracting us. So even if you think about planning your list to go to the grocery store and you want to make sure you get everything there, and sometimes I know when I've gotten home, I've realized I've missed something because I got distracted, maybe my cell phone went off or something like that, and I just always think if I had had a checklist, I would have, remembered everything and saved a trip of having to go back to the store for that one thing. And we think about that a lot even within childbirth, and it's a complex process, and memory often fails us when we're doing more than one thing at a time, or if we're under stress, or if there are lots of distractions. And checklists work by helping us remember everything we need to do. They also provide a structure so that we can complete the tasks at the right time and the right place. And the other thing that the Safe Childbirth Checklist does is we believe it really enhances teamwork and communication by providing transparency and accountability around all of the items on there. When you go in to explain the 4 pause points, it's important for you to encourage participants to identify what they're already doing. And this can be a time where you can really get the audience engaged. And for example, you could ask them, on pause point 1 at admission, how do you normally assess the mother for risk? And this is a time to actually demonstrate that all of the items on the checklist are things that most of the time they're probably already doing. And it's showing that these are all the essential birth practices that are in our national guidelines. And it's a time also to encourage them of the importance of the structure. When you demonstrate how to use the checklist at your launch event, it can be great to use performances, props, simulations, pictures, anything to really encourage your audience to get involved with this process and not just be passive listeners. This also ensures that the checklist is understood. And This is also a time to anticipate and address any concerns or challenges that participants may raise. For example, we often hear people say before they've used the checklist that they're concerned about the amount of time that it may take to use it. And this is a time, maybe you could do a time simulation with them and actually go through one of the pause points and time it. And that's a great way to show that it only took 1 or 2 minutes. And you can share stories in your own experience where using the checklist actually saved you time because you didn't have to go back and do something that you'd forgotten in the moment. One thing we also, when we're talking about using the checklist that we try to remind people is to just use one checklist for each mother and let that checklist follow her through the entire facility, even if you are doing a handoff to another nurse or provider at the time. Another thing that we think is important to talk about at the launch event is how implementation will be supported. And we want everybody to know that this implementation is ongoing. You're going to have people around you to address any concerns you may have or answer your questions. And the team is actually going to work with you to identify gaps and possible solutions to those things. And we're going to spend time on our next webinar talking a little bit more about what that implementation support looks like through the use of coaching. So I'm going to turn it back over to Nabiha for another poll.
Thank you so much, Emily. Let's take a moment to hear from all of you about the challenges that you anticipate with engaging participants and holding a launch event. You should see the poll question on your screen.
Just a few more seconds on that poll, everyone. Nabiha, you should be able to see the poll results now.
Thank you so much, everyone, for your feedback. It seems that most of our participants would anticipate the challenge of ensuring active participation among all staff members and potentially staff morale and motivation. So we can certainly take some questions about these anticipated challenges during our question and answer period at the end of the webinar. Now, we would like to get to the heart of our webinar, which is to hear from the voices in the field. And we are pleased to introduce and hear from Tunis, a dedicated nurse and Safe Childbirth Checklist coach working in Banda, Aceh, Indonesia. I will now pass it on to Tunis to explain to us his experience in Indonesia.
Hi, everyone. Apologies for that. We're just having some technical difficulties on our side. One moment, please.
Hi everyone, I'm Tunis from Indonesia. Perhaps maybe you have not heard anything about our country. Well, this is a big country actually with more than 250 million population. We are in Southeast Asia. Perhaps you know Singapore or Malaysia. They are our neighbor. And well, I'm from Aceh actually. It is a province in Indonesia. In this province we have like 5 million population, and we will do. I think we are doing the program, the checklist trial in 3 districts in Aceh, and we just finished this week. And today, of course, I will share my experience doing that launch event. Well, before I go to tell you my story with the launch event, perhaps you know tsunami 2004, and that what happened in my place in Aceh, and I was there in the water. But thanks God, I was survived, and now I can talk with you. Well, I have done actually myself 2 launch events in my place because I was responsible for those two places. The first one is a hospital with less than 20 beds, but they have quite a lot delivery every month. They say now they have like more than 20 deliveries every month. So almost every day they have 1 delivery. And another facility is we call Puskesmas. Puskesmas is an abbreviation in Bahasa Indonesia, which in English we might say as a healthcare facility. So if a hospital is a general hospital, you know it. And in Puskesmas, they serve the people in their area. Means if you have problem with your anything with physical problem, then you can go there. Also, if you want to deliver your baby for antenatal care, you can go to Puskesmas. You don't have to go to the hospital. Puskesmas is kind of first tier of health service in Indonesia. Well, as I said, I have done 2 launches. It's the one is in Puskesmas. We have like 21 midwives, and the Puskesmas is located in the rural area, and you know the people mostly they are farmers, and the Puskesmas they have like 8 beds, but not they don't have always patient. I mean in-patient there, but they have always out-patient every day. Usually from 8 until 12. But you can go there anytime you want. Okay, that's about Puskesmas. And what I did for launch event, because you know it takes around 3 hours, because we start usually with introduction, why we do this research, who are responsible for this research, and so on. So we usually bring something to them to drink or to eat. But because the distance from Banda Aceh to that Puskesmas is far away, and it's rainy now in Indonesia, and I took my motorbike because we don't have car. It's difficult to take car to that place. So when I usually, not usually, it's one time only so far. So I went there like 15 minutes earlier. I mean, I arrived there 15 minutes earlier, and I had a chat with my classmate actually who is working there now, and I gave her some amount of money, like $20, to buy some food. And of course, the small market just behind that Puskesmas. So before we start, she brought something with food that's for more than 20 people. So $20 for 20 people is not that much. And okay, and when all the midwives were there, then we start with the launch event. Of course, for launch event, we have like introduction first by the head of facility. In this case, a medical doctor who is head of facility. She has been working there quite long time, so she knows what they need and what the problem they have. And of course, beforehand, I taught her what the purpose of this project, why we need to do this project, and why we need the midwife to participate in. That also was her message when she started opening the launch event. And after that, of course, I start with my program, telling story like why we need checklists, why we cannot rely only on our everyday experience, why sometimes if we forget something, might be fatal to the patient, to the mother, to the child, and that's how it works. And of course, after like more than 1 hour of discussion or presentation and discussion, and also role play, I think I've seen the very good response from them. They are very motivated. They know they need to reduce mortality rate, which is quite high in Aceh. Now we have like 24 cases every 1,000 delivery. That's for maternal mortality, which is high and higher than the national average. So our goal, of course, to reduce the rate. And that's why I think they are very motivated. For the challenge, they don't really have a challenge because, you know, if sometimes in other facilities they have a problem with water, we don't have that kind of thing because, in fact, we are rainy now. We have a lot of water here to clean our hand or everything like that. And supplies and equipment also well prepared. It's always, they can always request it from the health office or the other facilities where it's available. So the point is, I think the most important thing we should start to convince them why they need to participate in. Otherwise, if we just tell them that they need to do this because this is for our research and they won't see any benefit for them, I'm afraid that they won't really very serious to participate in these filling checklist things. But if we can convince them that their job is not really that difficult, they just that checklist will help not to monitor their jobs, their practices, but just to remind them in case they forget something. So just a very small thing, not really disturbing, not really hardworking for them. I think they will agree to participate in, and I've seen that from my participant. And now we keep really good in touch with them because next week I will go there again for coaching, and of course we still in touch with them. So yeah, I think that's the only thing I can share with you because this is important. I think the most important thing is that at the very beginning try to convince them that this is not only for them, this is not only for their work, this is about helping others. This is about reducing. This is about preventing mother from death. And that's I think my experience. I wish you good luck with your launch and coaching also your country. And thank you. Okay, thank you, Emily.
Thank you so much, Tunis, for the wonderful description of your experience and for this lovely photo, which was taken after the launch event at the facility. We really appreciate you sharing your experience. Now we'd actually like to hear from a team working in Chiapas, Mexico. So we will be hearing from Jimena Vilar and Dr. Rose Molina.
Hi everyone, my name is Jimena Villar and I'm the M&E and Research Coordinator for the Maternal Health Team for Partners in Health Mexico. Thank you for giving us this opportunity to share with you our experience with the implementation of the Safe Childbirth Checklist here in Chiapas, Mexico. As you can see in the first slide, this is a map of Mexico, and you can see Mexico City. Well, Chiapas is the orange state, the southernmost state, and also one of the poorest states in the country. In the next slide, you can see the state of Chiapas, Tuxtla Gutiérrez, which is the capital, and the 10 clinics where we're working. So Partners in Health is a global health non-governmental organization that aims to provide a preferential option for the poor in healthcare. here in Chiapas, as I said, we operate in 10 rural communities and have this year just started working in a rural hospital. The rural hospital is one of these 10 little houses. So the adapted checklist has been implemented through a collaboration between Partners in Health, the hospital we're operating in, and different governmental officials. I say adapted because we have adapted the checklist to the local context by including Ministry of Health guidelines and respective maternity care practices. So what population are we working with? The hospital that we're working with serves a rural population where the main employment is subsistence farming of corn, coffee, and beans. The hospital is located in the town of Untitled with an average population of 20,000, and it serves as well smaller communities around the town. These communities can be located anywhere within 10 minutes away from the town to 3 to 4 hours away. In total, the hospital attends approximately 600 deliveries a year. In the next slide, you can see a picture of the waiting facility for the hospital, and in the background, the hospital itself. So the hospital has a capacity to attend vaginal delivery 24 hours a day, but OBGYN is only available 2 days a week. We cannot do C-section because we don't have an anesthesiologist or surgeon on staff. The closest blood bank is 2 hours away. The future facility that we're hoping to work with is a birth center being built attached to the hospital, which should be opening early 2017. The goal with the birth center is to allow obstetric nurses and midwives to attend low-risk delivery adjacent to a hospital setting. So in the next slide, you can see our delivery room. So the actual facility has 3 labor beds and 1 delivery room. And as I said, the picture here shows the 1 delivery room that we have. On the next slide, I want to talk a little bit about the implementation team. Although the implementation of the checklist has required the participation and buy-in from many members of the community, the immediate implementation team consists of 14 people. So on the one hand, we have the Partners in Health, Compañías en Salud office, which constitutes the director, the clinical director, the maternal health coordinator, an OBGYN advisor, the medical intern, and my position, which is the M&E and research coordinator. On the other hand, we have the staff working at the hospital on a daily basis, which is where we're implementing the checklist, the Hospital Básico Comunitario Ángel Albino Corzo. So it's the hospital director, a perinatal nurse, the midwife, and 5 obstetric nurse trainees. Although the hospital has a bigger staff of nurses and physicians, the perinatal nurse and the midwife and the 5 obstetric nurses are the 7 only people who are currently using the checklist. The checklist is being implemented on every patient that has their delivery at the hospital. At the next slide, you can see a little bit the faces of the team. So on the picture on the left, you can see Andrea, starting from the left. Andrea, which is the maternal health coordinator, Rose, which is the OBGYN advisor, Emily from Marianne Lab, Diana, who is the hospital director, and Liliana, who is the medical intern. On the picture on the right, you can see the 5 obstetric nurse trainees, as well as Emily again, me, Jimena from the KH office, Rose, and Liliana again. So talking a little bit about the implementation of the checklist. So the obstetric nurses, the perinatal nurse, and the professional midwife started using the adapted checklist in August of 2016. That is the same month in which they started working at the hospital as well. The checklist was initially used in paper format, and on the 20th of September of 2016, we switched to a tablet format. So we developed a mobile app platform for the checklist itself using a program called ComCare. And so this mobile app was created for the checklist itself and for the observation and coaching tools. This allows us to capture data in near real time. With this data, we're building a data dashboard with key quality indicators for ongoing quality improvement efforts. So currently, as as I was mentioning, these seven staff are using the checklist on every patient at the hospital. This implementation requires an ongoing accompaniment for sustained behavior change and political buy-in in a community hospital that did not have a similar quality improvement mechanism prior to this work. It's also important to note that prior to August 2016, nurses and midwives were not allowed to attend deliveries at the hospital. We've calculated that the full implementation of the adapted checklist with all staff members of the hospital will require about a year. But we do believe that the adapted checklist has helped to standardize care around childbirth and has formed a foundation for ongoing quality improvement opportunities. The other thing to note is that we haven't yet gone on to start with the observation and coaching tools as we face some challenges that we will be talking about in the next slide. So in the next slide, I want to talk a little bit more about the launch event. The launch event hasn't happened yet, and we're determining this week when it will be happening. We're thinking it's going to happen in November or at the latest the first weeks of December. So the current status we're in is that we have met with the leaders from the Gender Equity and Reproductive Health Centers, which is the federal branch of the Ministry of Health focused on maternal health. We have also met with the hospital director, with the chief nurses, and with the hospital physicians about the checklist. So why has the launching event not happened yet? So as mentioned, we have run into several challenges which I'm sure are not unique to our setting. Firstly, we have had some political issues with the hospital regarding the new staff working on the implementation of the checklist. The staff that is actually implementing the checklist is new to the hospital. So therefore, creating a positive relationship between the new staff and the previous staff has been important before setting a date for the launch event. Navigating the process of changing the hierarchy at the hospital from only physicians attending deliveries to now having 5 nurse trainees, a perinatal nurse, and a midwife attending the deliveries has been challenging. We have wanted to set a launch event that when we are confident that the staff will be open-minded to the checklist and not dismiss it simply because of tense relationships between the staff. Another thing that we have been facing is the different events taking place every week at the hospital that have been prioritized by the hospital leadership. These events can range from anything such as campaigns or bilateral to litigation or various base, different brigades, governmental visits, and the typical national holidays. The third challenge that comes to mind is the lack of opportunity that we've had to get all the hospital staff in the same place at the same time to present the checklist in one launch event due to the way shifts are organized at the hospital. So for example, the OBGYNs at the hospital only 2 days a week, while other doctors have shifts on the weekends. So it's hard to get those two groups on the same day at the same place. So what are we going to do to address these issues? So firstly, we're coordinating dates with the medical director at the hospital. This means organizing shifts with various launching events if we cannot get all the staff together in the same place at the same time. We're also currently addressing the political situation, smoothing things over, but we are very confident that this process has been going in a positive way, and we can see that with small changes we've made with our team, we've been really changing the relationship in a better way. In the last slide, I kind of want to talk about the lessons we've learned here in Chiapas with this process. So I think it's really important to say that the implementation and evaluation of the adapted checklist has been possible only through a multidisciplinary team of physicians, nurses, midwives, researchers, and administrative leaders. It's also important to say that the involvement in the Ministry of Health at all levels, whether that be federal, state, or local, is critical for the success of the program. And finally, that the implementation and evaluation requires an ongoing accompaniment to support the supervision and inclusion of all members of the care team. And this requires long-term investment of time and energy. That was what I want to present, and we're open to any questions if the internet permits it. Thank you so much.
Thank you so much, Jimena and Dr. Rose, for sharing your experience in Chiapas and for being so open and honest about the challenges you face and how you plan to address them going forward. I think what we'd like to do now is take a pause and respond to another poll, which is how likely are you to use a lesson, tool, or resource from this webinar? You should see the poll on your screen now.
Hi, Nabia. You should be able to see the results now.
Thank you, Jim, and thanks to everyone for responding to the poll. So interestingly, it seems that participants are uncertain about what to take away from this webinar, and some are also likely to take away something that we discussed today on the webinar. But what would be great is if we could discuss any questions that you may have or any concerns that you may have about this process in the implementation pathway. And we'd also like to, open up questions for Jimena and Dr. Rose as well from their experience in Mexico.
Thanks, Nabiha. So just to let everyone know the functions to ask a question, if you look in the Participants tab on the right-hand side of your screen, there's a little hand icon, and that's the raise your hand function. If you want to ask a question, you can raise your hand and we can unmute your line so you can ask your question to our group of panelists. Or if you would rather chat the question to us, please feel free to use the chat function to send any questions along and we can voice those for you. We have a question that came in through the chat from Maria. She stated that it looks like most of the experiences are in the first level of care, and she was wondering if we had any examples of someone that's in the third level of care.
Thank you for your question, Maria. Are you referring to tertiary level of care? Is that what you mean by third level of care?
She just responded, yes, Nabiha.
Great. So in our first webinar of the series, we actually had a wonderful obstetrician and champion from Namibia who implemented the Safe Childbirth Checklist in a district-level hospital in the Gobabis region. And that hospital was a tertiary facility that provided a range of care for a very large district and was the only facility in that region. You can find the recording of the first webinar in our community portal, which we can share more information about at the end of the webinar. But his experience was a wonderful one to take some lessons from. Thank you for your question, Maria.
Nabiha, we have another question. This one is asking, how can the checklist be helpful with accreditation of the hospital as a baby-friendly hospital?
Thank you for this question. It's a very interesting question about how the checklist could be used as a proxy, if done well, of course, in the facility, as an indicator of quality of care. And in a large trial that we are implementing in Uttar Pradesh, India, alongside Population Services International, the program is called Better Birth, and it involves 120 facilities in Uttar Pradesh. The checklist was formally endorsed by the government of India as well as the government of UP. And while it's only being implemented in a few facilities across the large state in India, it has been seen as a marker of quality of care. And so this has been an interesting discovery as we have learned from patients and their families about how they view the checklist and how they experience the checklist as part of their care in these facilities. Thank you for the question. Great. So we have a question from Dr. Catherine Semrau, and she's asking about the length of the launch event. So in particular, since we have Jimena and Dr. Rose on the line, for your team in Mexico, how are you planning, how long are you planning to host the launch event? Do you have an estimate for the amount of time you believe it would take?
Hey, this is Jimena from Mexico. So I don't know if I was meant to answer the question first, but we were looking at a shorter time frame, maybe 45 minutes to an hour, mainly due to the fact that logistically it's hard to get.
I'm sorry, Jimena, it seems that we may have lost the connection with you, or we can't hear you at the moment, but we heard you respond that you are estimating about 45 minutes to an hour. I think you're back. Hi, Jimena, are you there?
Yes, I don't know which part you heard.
Yes, I think we heard you say approximately 45 minutes to 1 hour.
Yes, because of the logistics of getting everyone in the same place at the same time, we want to make sure we keep it to a length of time that we allow people to get to work or go back home to come on their free day, while keeping it very interesting and dynamic.
That makes sense. Thank you, Jimena, for sharing that perspective.
Jimena and Dr. Rose, this is Emily, and I was actually wondering if you could maybe share with us a little bit about how you guys have started implementation and you guys are already using the checklist with some of your providers there. And I was just wondering how that's been going since the launch event hasn't been able to take place. And I think that that may be a common scenario, like you said, for many people having the same challenges. But I was wondering if you could just share a little bit about how that experience has been going so far without maybe everybody in the facility knowing exactly what's on the checklist.
Sorry, Emily, this is Rose. I couldn't quite hear the full question. Do you mind repeating it once more?
Yes. So I was just wondering if you could share a little bit about how it's going implementing the checklist, even though you haven't been able to have your launch event, because I think that that may be common in other places that sometimes it goes out of order. So I was just wondering how that was going and if you could talk a little bit about that.
Chiapas was to focus more on first building a solid team with trainees and our professional midwives and our clinical
I think we're having some trouble with the connection, Rose. If you wouldn't mind responding to the question through the chat function, that might be an easier way.
Forward to the hospital in a public sort of launch event would worth our initial time.
Hey everyone, we have another question that came through the chat, and this is about formal training to train all of the professional staff on the checklist and what people have done around that.
Yeah, this is Emily. Thank you so much for this question. And that's actually what we look at as the point of the launch is to actually provide that formal training to train the professionals on the checklist. And that's why sometimes we've seen it take a little bit more time, if possible, with the team to actually go through each part of it. And if there are certain items on there that your team isn't comfortable doing or they need more training on it, that's a time where you guys could actually do some demonstrations. Thank you so much for your question.
So as we wait for a few more questions to come through, we'd actually like to refer back to the beginning of our webinar where we asked a poll question, and it revolved around topics that people would like to learn more about in terms of the engage step of the implementation pathway. So I'll pass it on to Emily to talk about two key concepts which are part of the engage process.
So one of the things that you guys had highlighted was just more information on conducting a needs assessment. And this is something that we talk a lot about what needs to be in place before you're ready to implement. And we look at this as almost laying a foundation for the work that's about to begin. And the big thing that we talk a lot about is just making sure that you have leadership support. And so talking to the key people that are going to get behind this and actually help you roll it out successfully to the other members of the team. We also think it's important to look at your resources and your system capabilities. And this is a time where you can really just evaluate what's working well and maybe some things that you're anticipating could be challenging about rolling this out. And another thing we ask people to consider are what other competing priorities are happening at the time. So if your facility is in the process of rolling out another big new project, we think it's important to consider timing, and so that the checklist can get the attention that it needs at the time, and it may be beneficial to actually wait, a couple of months if something else is going on at the time.
Wonderful. Do we have any additional questions from the participants on the webinar?
It doesn't look like anything else has come through on the chat, Nabiha.
Okay, thank you, Jim. So again, if any questions come up or after reflecting on the topic today, something comes to mind, know that we have an online portal where our community members and participants from webinars have come to share their experiences and also to ask questions. Also on our website, you can find both the Safe Childbirth Checklist and Implementation Guide. It is available in 3 languages at the moment, English, Spanish, and French. You can also find the other tools from our serious illness care work and safe surgery work on our website as well. The next webinar in this series will be held in December, and as Emily mentioned earlier in our webinar, this webinar will focus on how to support implementation of the checklist through a coaching approach. And we will be, again, hearing from voices in the field and, of course, saving time at the end of the webinar to answer any questions about this topic. More information about this webinar, along with the resources and recording, can be sent to you via email shortly after we close. And today's webinar, as I mentioned earlier, along with the other webinars in our series, are available in our community portal, which you can find through this link here. And again, if you have any follow-up questions, please feel free to contact the email address listed here. So again, I'd like to take a moment to thank our presenters today from Indonesia and Mexico. It's always wonderful to hear from the field the realities of both, the successes and the challenges, and we appreciate your attendance on the webinar, especially given the connectivity issues. So we apologize for those of you that could not hear entirely, but again, the recording will be available, as will the slides. And we look forward to seeing you all in December when we host our next webinar in the series. So again, I'd like to thank you all and the participants for your time, Emily also for facilitating today's topic on launch, and we look forward to seeing you in December. Take care.